Hello, I'm Dr. Payam Hakimi from Body of Harmony. We're your source for integrative and functional medicine information. Today I want to talk about treatment of upper respiratory infection symptoms with homeopathy. Specifically, a lot of the viruses are going to have the same symptoms. So the virus of the flu virus, the other viruses are going to have the same symptomatology. So they're all going to be exactly the same thing. COVID virus is going to be exactly the same thing. The symptomatology is going to be the same. So the homeopathic medications that we use for that is going to be the same as every one of them as well. So it's also important to talk about homeopathy a little bit. Remember, homeopathy is about treating symptoms and it's not a treatment for anything. And I've talked about this before as well, but let's review it. If you have cough, it basically means you either have a virus, a bacteria, an allergy, or something else that's causing a gastroesophageal reflux, an acid, or something that's causing that cough, right? So there are two things that we need to do. We need to treat the underlying condition, which is the bacteria with antibiotics, the virus, the acid and everything else. But you also need to symptomatically treat the cough, so get rid of the cough so you can sleep at night, so that you're not coughing the rest of the day and irritating your upper respiratory. So it's important to appreciate that homeopathic medications are just symptomatic treatments. They're not necessarily a treatment of cause at this point, in this situation that I'm talking about. We can talk about homeopathy later and how it treats different medical conditions, but for the time being, we're talking about just treating the symptoms of an illness, not the illness itself. So once an illness starts, a viral illness, our first signs are going to be body aches, fevers and chills, maybe a little bit runny nose, we're tired, and those are the symptoms that we're going to feel. The most important medication I use at this point is going to be oscillococcinum. It's a medication that has proven scientifically to help decrease the duration and the severity of symptoms of flu. So that's what we use right away as soon as we get it. The other ones are going to be a medication called Aconitum napellus. Aconitum is a very important medication because it treats the sort of the beginning phases of a viral illness with the body aches, with the fevers and shivers and hypertension and all of that is going to be covered in Aconitum. The other one that we use is Ferrum phosphoricum. Ferrum phosphoricum is very important because it also covers the fevers, the body aches, as well as some of the symptomatology that comes, like ear pain and throat pain, and all that is going to be covered with Ferrum phosphoricum. The other one that we use specifically is Allium cepa, which is for symptoms of having runny nose and sort of runny eyes, and again, that's something that starts at the beginning of these the beginning stages of viral illnesses. And then the other one that I really like is called Phytolacca. Phytolacca is a very important medication for sore throats. It's probably our #1 medication for sore throat. So I use that a lot in our clinic with a lot of our patients. Usually by this time, some of our patients get better. And remember, you've already done your vitamin C's and vitamin D, and if you're one of our patients, you've received your IV nutrition from us and our immune stamina and everything else that we do for our patients. If at this point, the illness does not resolve itself and it continues to the next stage, which is going to be the infectious stage, the symptoms change a little bit. So at this point, there's going to be a more severe cough. There's going to be phlegm with cough that might be colored, yellow, green, brown. There's going to be same thing with runny nose. There might be color to it, yellow, green, brown, red, depending on how sinuses get involved. And the cough and sore throat will get a little bit better. Sometimes right before this, there's also a period of diarrhea with a lot of viral illnesses. We treat the diarrhea as well with medications that I'm going to talk about in a sec. But for the infectious stage of a viral illness, an upper respiratory symptomatology, we use belladonna, which is a little bit more symptoms, a little bit more almost sweaty and red, hot, and severe sore throat and headaches and sort of sensitivity to the light, all of that comes in. The medications that are used for cough are Drosera, Spongia, Blata, and Sambucus. And these are the group of medications that I also use for wheezing and for asthma attacks that work amazingly. The other one is antimonium tartaricum, which is a sort of a asthmatic cough where the patient wants to cough and bring up phlegm, but the phlegm does not come out. We also use cuprum metallicum, which is a medication of spasm, and a lot of the times there is a feeling of suffocation in the lungs. So cuprum and lachesis are very important medications to use. Gelsemium still used at this stage for headaches, for body aches, for muscle joint aches, for fevers. All of that is also covered with gelsemium. And if I feel that my patient is getting worse, then I put them on other medications like phosphoricum acidum, which we've talked about before. It's a medication for almost an adrenal insufficiency where the patient feels tired and feels fatigued but cannot sleep at night and they're jumpy and jittery. So phosphoricum acidum is very important. Arsenicum album is a medication for severe toxic infections, so it's important to have that. Podophyllum is a very good medication that I told you about for diarrhea, for traveler's diarrhea. These are the medications that are very important to have at the same time. And then with certain conditions that sort of requires lungs to need a little bit more air, we use a specific medication that's called Carboveg. And Carboveg is a medication that is used for people who have a hard time breathing, almost like what we call in medicine COPD, sort of a severe asthma. COPD we use Carboveg for. And it helps out with symptoms. Again, not to sort of confuse this with a treatment of any of these conditions, but at least for the symptoms that I talked about, you can take care of a lot of that with homeopathic medications. Remember always, if you start any homeopathics, if you start any integrative alternative medicine and you see that your symptoms are not getting any better or they're getting worse, you need to appreciate that maybe those medications are not working and you need to see your primary care doctor so that they can actually treat you for the condition that you have. It is important that when you use homeopathic medications, you use one of the physicians who know about homeopathic medications. There are a lot of homeopathic medications. Obviously, it's a course that requires some time for the physician to actually learn homeopathy properly. And if you choose the medication incorrectly, obviously it's not going to work. So if you plan to use any homeopathic medications, please get in touch with one of us. Let us help you and figure out exactly what you need. I want to thank you for listening to me, and if you like our videos, please like and subscribe to our channel, and we'll be back every week with more videos and talk about more conditions that we can treat with different aspects of functional and integrative medicine.